Good afternoon. This is part 2 of anxiety and stress that I started talking about in the last video as the major symptom, general symptom for people who are coming to me as patients. So what I'm going to do now is get a little bit more specific about how what I'm teaching and guiding people through is helpful. And so in the end, I'm working with the body primarily. So the early sessions are really discovery. When we're doing the guided touch exercises, as I shared earlier, you and I, sitting on the floor face to face and beginning to just share with you like how to go in, how to do the breathing, how to access that, how to begin to listen to your body and notice what it does naturally, how to gently guide it to lengthen and go deeper with breathing, how to sit in that. In other words, there's a lot of like how to sit in discomfort, because when anxiety is in the body chronically, it's always there. So breathing into it and sitting into it and just letting it be is just something that can be excruciating. Like nobody wants to do that. So there's so much distraction that we create so that, we don't have to feel it, right? So, a lot of that is, again, just staying chronically busy and staying in the head and avoiding what you're feeling. So when you start to open to, after the breathing, to what you actually feel with sensation focus and, touching the hand, what do I feel? Is it warm? Is it soft? Is it cool? Really keeping your focus there begins to train your body to be able to notice the difference between when I'm focused on what I'm actually feeling, literally, and when I'm now escaped up to the head, which happens moment to moment, right? Because we have the monkey mind. So that is always going to be there. However, what this process has the ability to do is begin to replace what how a person's been kind of wired, if you will, with the anxiety and the retreating and the disconnecting from the body. And it begins to like really, as you sink further into the discomfort of what, sometimes it feels good, but often it's uncomfortable to breathe for longer into what you feel and stay in it. Over time in practice, you go deeper with that. You get comfortable with it. You're able to actually maybe even kind of surrender into these moments, and then you reset. Then you notice, okay, I noticed the difference. Before, when I was giving or receiving touch, I was really aware of what I was feeling actually. Now, oops, okay, I lost that. I'm somewhere else. I'm thinking about tomorrow or what I'm going to have for lunch. So it's like, then you come back and we reset and we refocus. And this process of refocusing on the moment, what you're actually feeling when you're touching or receiving touch, it over time begins to create, it has to, new neural pathways. And so science supports this, right? With a lot of studies that have been done now in terms of, we know that if you do something physical consistently over time with cognizance, with intention and repetition, that it's likely going to take, and you're going to be able to call on it as a new patterning, like I've described earlier, like similar to learning anything physical, right? Swimming, riding a bike, anything that, dancing, right? Anything that requires you need to learn through your body. Reading a book's not going to do it. Listening to a podcast, not going to do it fully. How are you going to master something physical, right? How are you going to feel comfortable doing it unless you actually do it, right? So it seems obvious. However, this is the missing link, I think. And so what the tools that I'm showing people as the process gets more intimate and we begin to apply it, as I described earlier, to what I call arousal navigation, then at that point, you've already learned and practiced how to do all this over and over. You developed a trusting relationship. You believe that it's a safe place to practice, and not judgment-free, as I said, and just really let's discover what's happening with your body. How is anxiety showing up? That's the key. How is it showing up? Do you feel it in your chest? Do you start to get tight in your groin? Do you start tensing your butt? Do you clench your shoulders? There's so many things that the body's trying to tell you, this is happening, and you're like often ignoring it or trying to suppress it. So when you actually begin to breathe into it and focus, what happens is it lifts, usually, at least a bit. In the beginning, it begins to lift. And it's imperceptible almost, maybe at first, maybe not. Sometimes it's pretty dramatic difference depending on the person and the process that you're in, your healing process, how it moves. It's slow. It's gradual because, again, and I've witnessed it work over and over, so that by time a patient leaves working with me, they've got a good grasp of this and have the confidence to be able to use it and call it forth to replace the anxiety that's so patterned in when needed. And I guess the last thing I'll say is, changing human behavior is probably one of the hardest things to do. And mainly because it's so wired, because we're so creatures of habit, and especially the fight, flight, freeze. That's survival, that we have to have it. So we can't eliminate it, but you can lessen the grip of it. And you can create new neural pathways to be able to call upon a way to find ease in your body and experience it. And that's really what this is all about. So I hope that was helpful, and I'm going to stop there. Take care.